Good day, everyone, especially to our dear panelists. We are the Group 2A from Rhyssa and PD. I am student nurse Daisyree Dasas, and together with me are student nurses Freya Corpuz, Angel de Guzman, and Noela Diaz. Today, our group will be presenting our research study entitled Lived Experience of Elderly Individuals with Chronic Diseases in a Community.
Numerous healthcare systems serve elderly individuals with multiple medical conditions. However, this often leads to challenges and loss of functionality. Gender, education, chronic diseases, and hearing loss may lower older adults' quality of life. Thus, the researchers were able to explore how older individuals with intricate health conditions participate in and interact with their treatment trajectory inside various healthcare systems, including healthcare professionals. For our statement of the problem, the study aimed to explore the lived experience of elderly individuals with chronic diseases in a community.
For the theoretical framework, within the context of elderly individuals who are experiencing chronic diseases, Cohen's theory offered valuable insights to the relationship between the process of adapting to retirement and role discontinuities and the difficulties associated with effectively managing health issues. On the other hand, this study utilized Newman's model to conduct a thorough analysis of the individual's reaction to chronic diseases in the community. For our conceptual framework, to provide a comprehensive understanding, the study integrated Lachica's theory on retirement and role discontinuities and Betty Newman's system model. This study focused on pivotal variables, namely age 60 to 85 years old, male or female, and marital status.
Now, for our significance of the study, presented here hierarchically, the study's results held significance for various stakeholders. It could enhance practices to better suit residents' needs and enhance nursing education. It could also be used to adopt person-centered care approaches. Elderly residents could experience boosted autonomy and improved quality of life, and family members could provide informed and compassionate support. It could develop empathy and compassionate care, and it could contribute to the knowledge on aging, resilience, and chronic diseases.
Now, we will discuss the methodology. For the research design, the researchers employed a phenomenological approach, a qualitative research designed to explore the lived experience of elderly individuals in a community. The researchers made use of an in-depth interview method to collect the data. Now, we will move on to the participants. The researchers employed a non-probability purposive sampling method to select 8 participants adhering to the inclusion criteria. Participants in the qualitative study were selected from a community. Now, for the instrument. The researchers utilized an interview guide. It consisted of 2 parts. The first part contained the demographic profile, and the other part focused on open-ended questions about the impact of chronic diseases on daily life and overall well-being, as well as coping strategies. These questions were validated by experts such as guidance counselors and medical practitioners.
Now, for the data gathering procedure, the researchers started by seeking ethics approval from the College Research Ethics Review Council, followed by scheduling interviews where informed consent was obtained. Participants engaged in in-depth interviews until responses became repetitive. Data collected was recorded, transcribed, validated by participants, and used to write results and discussions, leading to conclusions and recommendations based on data insights. For data analysis, collected data underwent rigorous analysis using Collise's method, facilitating the identification of emerging themes and relationships in lived experiences through in-depth face-to-face interviews following a 7-step process. The study ensured credibility and rigor by adhering to Lincoln and Guba's framework, emphasizing credibility, confirmability, transferability, and dependability.
For our ethical considerations, all participants' data remained private and anonymous in all records. They were also allowed to withdraw from the study at any time without repercussions. Finally, a USB flash drive safeguarded all data, and it will be completely deleted 2 years after research completion. Now for our results and discussion. Here is the table to show the socio-demographic profile of our participants. For our first subtheme, Sacred Conversations with the Divine, religion helped manage stress by providing productive thoughts and optimistic outlook on the world. The second subtheme, Embracing the Divine Path, the resilience of the elderly emphasized the role of spiritual well-being and adaptive coping. The third subtheme, anchored in the purpose of faith, personal responsibility extended beyond individual behavior to fostering religious and spiritual beliefs in family and in community.
Team 2, identified as Harmony in Heartbeats, explored how the participants nurture the relationship throughout their lives in personal and social settings. A study of Solastri and Cohere 2021 recommend that families support elderly members by focusing on adaptability, closeness, development, emotional expression, and problem solving for improved quality of life. The first sub-theme was Solidarity in Family, where family represented community and solidarity playing a crucial role in their social identity. The second sub-theme was Rhapsody of Emotion. It was revealed that elderly individuals tended to express their emotions more openly, especially when discussing their emotional well-being concerning family. The last sub-theme was Compassionate Love. Participants emphasized their family's vital role in care, decision-making, and health support, especially for chronic conditions.
For Team 3, resilience in embracing aging process while living with chronic diseases. According to Hassani et al. 2017, as people age, resilience plays a critical role in helping them overcome obstacles and maintaining better physical and mental health. It was manifested through expressing their happiness and dealing with vulnerability that comes along. First subtheme was staying happy. It showed resilience in aging by looking on things with greater perspective and just genuine happiness for what they did in years and coming. For the second subtheme was facing vulnerability. Participants significantly understood how easily they could get hurt or sick and how that could affect their ability.
Theme 4 is Thriving Through Daily Activities. Participants in this study displayed resilience in maintaining daily activities despite chronic diseases and emphasized autonomy in decision making. Elderly individuals, as observed in studies like Naik and Yuan 2020, demonstrated resilience by engaging in activities to combat loneliness and prevent depressive symptoms. The researchers identified productivity and responsibility as the first subtheme in the participants' daily routines, reflecting a positive status for active and productive elderly individuals. Leisure activities were identified as the second subtheme in participants' daily routines, emphasizing mindfulness and intentionality. And the third subtheme showed the importance of nurturing a positive self care routine, which had significant health implications.
In conclusion, among the themes, navigating life's path through prayer is the most prioritized. This research clearly illustrates that the values and achievements of older individuals are acknowledged the same as how they faced all the challenges and experiences living with chronic diseases.
Here are the recommendations the following sectors should consider: enhance community facilities for the elderly, integrate geriatric perspectives into nursing education, prioritize person centered care, communication, and autonomy, support seniors by understanding their needs and promote emotional readiness. Emphasize empathy, compassion, and ethics in nursing education, and broaden research to include diverse perspectives and longitudinal studies among the elderly.
And now for the utilization. The result of the study will be submitted to provide awareness for public health efforts in promoting healthy aging, preventing age-related diseases, and addressing elderly care challenges. It will also contribute to developing social services programs for older adults and educate healthcare professionals, caregivers, and policymakers on effective elderly care. The data derived from the study may serve as a basis to inform government policies to meet the needs of aging populations and promote empathy, person centered care, and empowerment for older individuals, countering ageism and acknowledging their societal contributions.
And last but not the least, here are the references that supported the framework of this research.
We acknowledge the help and constant support of these people. Thank you and God bless.